right. Right now, we are going to have our special guest, Loni Madar. She'll be calling in just any second, but she is a licensed speech pathologist. She's a frontline medical provider, and she's going to call and give us some insight on what's going on right now out in the world of frontline healthcare.
Yeah, we are super excited to hear from her.
Hey, Justin, how are you?
Good morning, Loni. How are you? This is we got Jason and Tess.
Hey.
Hi, Tess.
Thanks for being on Small Talk Arkansas.
Oh, thanks for inviting me.
So, as we shared, Loni's a licensed speech pathologist. She's a frontline medical provider. And Loni, I'll let you tell a little bit about yourself and what you do, and just share that with our listeners, please.
Sure, Jason. Well, like you said, I'm a speech pathologist. I work on the medical side of the field. Specifically, I work in the home health sector of speech therapy. And what I do is basically I'm part of a multidisciplinary care team that provides care for patients in their home after they leave the hospital or rehabilitation, or sometimes just have an exacerbation of a current illness. So anyway, so we're seeing lots of changes with recent events of COVID-19 and lots of concerns coming up there.
So you work inside the patient's homes?
Yes.
So you're seeing them in their location.
In their environment. You
don't know necessarily who they've been in contact with, who's been in and out of their place, or is there procedures and policies in place right now to protect you as a healthcare provider to limit that and to track that?
What our company is doing is we are doing, besides our standard precautions that we are doing anyway, we are doing pre-screening. So when we call to schedule our day in the mornings, we are screening our patients and we're asking a series of questions to determine if there's an increased risk factor in that patient's home that could present additional risk to the staff. And if there is, then we are making changes to increase precaution and increase infection control to try to keep those risks down as much as we can.
Sure, absolutely. Is it scary going into these homes? I mean, during this time, is that something that you have in the back of your mind that's a fear that you may catch this, you may come down with coronavirus being in front of a patient and then
an unfamiliar environment,
bringing that back to your loved ones?
Well, I wouldn't say I fear it, but I would say there's additional concerns. That being said, there's always concern of infection control. COVID-19 is not the first virus that we've been exposed to. There's tons of other viruses that are going around, and so that. But the new virus and the unknown about the COVID-19 and how it's transmitted and how it's transferred and all of the questions that are still hanging in the air, it does present with additional concerns. As a healthcare provider myself, of course, I have concerns about coming into contact and then carrying something back to my family or someone in my household or my loved one, and particularly the group that tends to be at more at risk. But that seems like it's changing a little bit, that dynamic of who really is at risk, and it seems like that gap is closing down a bit. As far as anxiety among home health care providers or just healthcare providers in general, I think that it's exacerbated by the COVID-19. But again, we're all supposed to be using a certain element of precautionary standard precautionary behavior anyway.
Right.
So we're implementing that. We're using good hand washing technique. Cleaning our equipment and doing the things to emit standard precautions. There's not, there's additional concerns, but it's not the overwhelming stress. It is a little stressful when you think about, you get into someone's home. What I deal with personally is the population that seems to be the most at risk also is the most at risk for being misinformed or not being informed at all or not aware. And in some cases, not even able to process the new learning that's necessary to protect themselves and to help prevent the spread of disease.
Right.
That's a great point right there.
Is.
You work with a lot of Alzheimer's and dementia patients. I suppose that certainly brings in a whole new level of challenge during a pandemic like this.
Mm-hmm.
Exactly. Trying to educate somebody with dementia or Alzheimer's to practice certain hygiene things that were not in place before is likely not going to happen. And so there's a different set of challenges that are evoked with that. Yeah.
So you do your particular, specialty in speech pathology. You do a lot of swallowing, things like that. And this particular, virus affects breathing and the breathing passage. How does that relate with the swallowing and the throat stuff that you deal with, and how has that really changed, or has it changed anything that you look for?
Well, as far as risk control and protection and things like that, swallowing therapy being, there's increased risk of infection just because of the close proximity that you are to someone's oral cavity. And so, as we discussed with the dementia patient and being able to know to necessarily cover a cough, and you're in close proximity with a patient, you really have to be your own self-advocate as far as protecting yourself from infection in those close quarters there, being up and working in somebody's mouth and dealing with bodily secretions, specifically oral secretions and secretions that work directly with the respiratory system.
Got it. So with all of this, and we've, watched the news and seen the fact that all of the tips and you mentioned the wash your hands, are there additional tips that you can share with us that maybe aren't as public knowledge out there that we should be doing to make sure that we're staying safe?
Well, the big thing that I would say is social distancing. That can't be expressed enough. Social distancing is fundamental to getting control of this virus. Using good hand hygiene. Making sure that you're cleaning areas that are touched frequently. That's an important aspect of keeping yourself safe. Here's the thing is another thing, hand hygiene can be soap and water. Make sure you're washing for an adequate amount of time, getting all surfaces of the hand, using hand sanitizer, avoid touching your face. If someone is sick, they should be wearing a face mask to try to prevent the spread. Something that I've seen a lot of is people are using tissues, but they're not disposing of the tissue promptly, or they're not using good hand hygiene after they use the tissue. So remembering to do those additional things sometimes can be challenging. We talked about cleaning surfaces. Right now, we have this issue with the hoarding situation going on.
Right.
Don't forget about basic cleaning supplies, bleach. You can use 5 tablespoons or a third cup of bleach to a gallon of water. Alcohol solutions that are 70% alcohol is a good, effective way to disinfect. The number one thing I think people can do to prevent or to protect themselves is to protect themselves from misinformation. Social media is full of misinformation, and people are buying into what they're reading, and so they're either overconfident that they're protected, or they're underconfident.
Yeah.
So
there's some crazy stuff out there.
Yes. So just use tried and true information sources. Don't necessarily, just because you read it on Facebook, it doesn't make it true.
Right.
There's
basically
lots of things.
We all need to be washing our damn hands, right?
Exactly. Wash your hands, clean your house,
and stay away from others.
Stay away from other people. Yeah. It's pretty basic, keeping areas like doorknobs and countertops and things like that we touch frequently.
Light switches.
Light switches and things that when you go, try not to everybody in the house go to town. One person, they have a designated person that does the trips into town, and that person, when they come back, have a routine for, okay, well, I'm not going to carry these shoes that I just wore into a possibly infected area. I'm going to leave these outside, or I'm going to leave these in a plastic container, and these will be my designated shoes that I'm going to wear to the grocery store, or when I could possibly be exposed to something that I could be carrying back to my home.
So it's not about fashion while we're out right now. We're just wearing the same utilitarian outfit that we wear every day when we go outside. People are like, that person only has one set of clothes.
Well, it's not so much the clothes. I mean, when you come in, if you are out in town and you're around several people, I would recommend coming in, going ahead and strip them down and wash those clothes. So it doesn't have to be the same clothes, but things like shoes that we don't wash after we wear them.
Yeah, I
would pick a pair of
outside shoes
or a pair of shoes that you can set aside for that function. And then when you come in, just drop them in a plastic container by themselves, where they're isolated from the rest of the wardrobe and not likely to rub up against something and transfer. I personally just went and bought a pair of shoes that are very similar to Crocs, but just because of their cleanability, and I can spray them down with whatever, and it's really not going to hurt them. But they're not very fashionable, but they are effective. And my thing is I take them off in the garage, and they don't ever go into my house.
Those are all really, really good tips.
Yeah, Loni, that's a lot. We appreciate you being with us today. Thank you so much for being a guest, and please stay safe out there.
Oh, I will. And then, Jason, I just have one thing that I do want people to understand is, this is a really tough time for everybody. So just everybody try to sit back for a minute and just practice being kind, be patient with each other, try to be helpful, and do be responsible and diligent and verifying information before you pass on information that is going to promote hysteria and fear and promote things that are going to result in hoarding and unnecessary steps that are creating more problems on top of a big problem that we already have.
Right. You're so right.
That's a very great point. I mean, in reality, it's just, be kind and think of others.
Mm-hmm.
Yeah, be calm. Realize everybody's carrying, everybody's carrying a big load right now. And, the poor people that's working at Walmart right now, I wouldn't want to be them for anything, and on top of their full-time jobs in Walmart, they're going home. A lot of them are going home. They're being a parent and a spouse, and now they're being a school teacher. And in some cases, they're the baseball coach and the dance teacher, and so they're putting on a lot of hats on top of working their shift and sometimes double shifts. And everybody's getting tired and everybody's wore out. Just be kind to each other and be patient, and we'll get through it. It's just going to take time.
We're all in this together.
We are.
Well, thanks so much for being with us.
Thank you. I appreciate you asking me to call in today.
Well, we appreciate it,
yes,
and
thanks,
we'll
Loni.
love to have you back.
All right. Thank you. Have a great day.
You
too,
too.
girl.
Bye-bye.